again. Thank you very much for your kind invitation. Dear moderators, distinguished panel, it's my pleasure to be with you in this ancient city. So, I still want to support that being a vascular surgeon is a mandatory, but there is something new at the horizon. So I just want to introduce you a novel treatment for long segment occlusion in femoral-popliteal disease. This is specially designed to achieve comparable results as an open bypass surgery, and for this, its femoral vein should be employed for a modular stent graft bypass. There are 3 pieces in a toolkit that are necessary to provide this procedure. This is a self-expandable PTFS stent graft with a different length, starting from 10 by 15 to 20. And this special kind of snare that is also a cage for supporting the procedure. Yes, sir? Okay, thank you. And the crossing device that the previous speaker was talking about, and of course, simple wires. So this is how the procedures looks like. It's the first step is to make a proximal anastomosis by catching a wire coming from the contralateral side, not from that way where occlusion is, and you snare it through the vein with this special kind of snare and cage, and bringing down to create a distal anastomosis by bringing the wire from the femoral vein into the popliteal artery that you can see here. And then some kind of balloon is bringing to the holes, making the holes bigger to prepare the vessels, the fistula, for regular stent grafts, the Detour stent grafts. And this is one of our patients treated on that way because we participate in the investigation of this device in Europe. It was the Detour study, and here you can see the initial angiography and the stump of the superficial femoral vein and the popliteal, artery and popliteal artery. And here you can see creating both anastomosis, proximal and distal. The crucial point is to position the C-arm in a proper angulation just to puncture a good site of the vessel, vein, or the artery. And here you can see the control angiography on this patient. So here is the visible proximal anastomosis, and here distal anastomosis, and inside is 3 pieces of torus stent graft implanted. And of course, it's mandatory to finish the procedure with the venography because, as I said, it's a crucial vessel to provide this procedure fully endovascularly. And we take a part in the try overview. That was objective of the study, was to assess the safety and performance of the PECU bypass technology and technique to treatment for long segment in this territory. So 77 patients were included with 81 lesions and treated in 3 global sites under the auspices of independent core lab that been looking for CT scans, duplex, ultrasound, and also clinical events committees. And all subjects were followed first for 1 and then for 2 years. So here you can see the inclusion and exclusion criteria. The most important exclusion criteria was the history of DVT, that it's very clear in this investigation. And we need not less than 1 vessel runoff and a patent femoral vein in the diameter not less than 10 millimeter or duplicate femoral vein. Our results and the other group we present in the Detour 1 month in different journals. So here you can see the 1-year and 2-year results of this technology, where we notice the secondary patency after 1 year at the level of 90% and after 2 years at the level of 86%. So they are very similar to open surgery with the regular bypasses. Also, there were examination of venous clinical severity score as well as VLATA score scale, and there was no change at the start of the procedure and at the end. So coming to the conclusion, we think that this initial experience with very attractive and less invasive Detour system and procedure demonstrates the potential as a durable, maybe not first line, but endovascular therapy for long segment SFA disease without compromising venous health. This investigation demonstrates improvement in anatomic, hemodynamic, and functional outcomes in patients with the long, most complex lesion. Thank you very much for your kind attention, and I want to add that Endologics, the company that produced this device, receives FDA approval of the Detour system last year. Thank you so much.